So the first thing I do believe every clinic needs is they need a champion. They need someone who believes in aquatic therapy, someone who's constantly driving it, making it better, utilizing it, and getting all the other therapists or all the other clinicians to utilize it as well. And if you don't have a champion, what ends up happening is you might have someone who goes through the phase for a little while where they utilize the pool in a high capacity, but because it's not their love, because it's not their drive, they fall back to land-based or dry land therapy. So the first is your champion. The second very, very important component is that you establish some sort of a utilization plan, some sort of a way that you're going to make sure that this pool is utilized at its highest capacity. That involves making sure scheduling supports the utilization of the pool, that the flow of your clinic enables that to be an easy thing, that it's not in the back, that it's not difficult to get changed, that you don't have to change in a bathroom in the front and then go to the pool in the back. Really, the way you set up the foundation of your clinic and the way you set up the build of your clinic will help flow patients through the pool easily and you'll use it a lot, or if it's challenging, you won't. So first is champion, second is utilization plan, some sort of utilization plan. The third really key ingredient is that your protocols implement aquatic therapy, that your ACL protocol has the steps that implement aquatic therapy use, that your total knees have the steps that implement aquatic therapy utilization. And once it becomes a part of your clinician's normal plan of care, their normal treatment protocols, it becomes ingrained in the system inside your clinic and you'll utilize that pool at a high capacity. If you never ingrain it into your protocols, you're never going to use it because the protocol's dry land, the protocol's driving you in a different direction. If you put pool therapy or aquatic therapy into your normal protocols, it will facilitate greater utilization or greater functional outcomes on land. It feeds into what happens in land. It makes your range of motion better so that when you're on land, you can do more functional activities, and it actually makes the dry land functional activities much less painful. And the last really key, very, very important component for my clinic being successful is the fact that we have early intervention, immediate post-operative care. We use bio-occlusive dressings, and there are a lot of bio-occlusive dressings on the market. The one that I prefer is OpSite, simply because I've had the greatest success with that in my clinic. If you find other ones like Tegaderm, things like that, that work better in your clinic, then by all means use it, but find one that works well and learn to protect your wounds. In my clinic, last year we had over 9,800 patients go through our pools with open wounds that we protected with OpSite. We've never had an infection over 4 years. We never had an infection when we did chart reviews last year. And actually when we did chart reviews last year, the patients who didn't utilize our pools actually had a higher rate of infection than the patients that did. I don't know that you can tie anything to that, but it's actually just a really interesting fact. So utilizing early intervention, putting a patient in immediately post-operatively. Typically our patients post-scope will get in our pool 2 days after, and post total knee, total hip, spine surgeries, those will wait 3 or 4 days simply because they're still hospitalized. We bring them in, we cover their wounds, our patients will shower off, and then they'll get in the pool. The thing that the pool does for early intervention is, first off, that patient has an environment that they can move. On land, they can't walk, they can't dress themselves, they can't do anything independently yet. And in the pool, they can walk, they can move, they can do exercises without a significant amount of pain. The other thing that the pool allows you to do is because of hydrostatic pressure, you get a return of venous, you get a venous return from lower extremities, and so you decrease the swelling simply by that. You're also in this very nice, warm, unweighted environment, and so they'll start to gently move and flex and extend that knee, or they'll allow you to flex or extend their shoulder, or they'll be able to stand and do things not causing any pain into their spine. And so just by simply decreasing the pain and decreasing weight bearing, that patient will move, and we know that movement breeds movement. The more you move a joint gently, the more it will want to move. The less you move a joint, the less it will want to move. And so the pool allows them to decrease the inflammation within a joint just by gentle range of motion, high repetition, low resistance. And the last thing the pool really does, the HydroWorx pool specifically allows you to facilitate early normal gait mechanics. And half of the battle at 6 weeks out after a total hip replacement, especially a total hip replacement that might have a protected weight-bearing status, is they've developed all these faulty mechanics to gait. They're walking funny, they're using faulty gait patterns, and breaking that habit is almost more difficult than getting their full range of motion or getting their full strength. So early on, the patient's placed on a treadmill where they can watch their own gait mechanics. They get the visual feedback, so when you tell them they're circumvecting their hip, or when you tell them they're not bending their knee as they walk, they can see it, and then they'll fix it themselves, and then they'll practice it, and then it'll carry over onto land. So someone who's had a non-weight bearing status or a decreased weight bearing status that normally would be walking without any weight bearing for 6 weeks, and then all of a sudden they're starting to try to facilitate normal mechanics, that person will have been practicing normal mechanics. So the moment that they can become full weight bearing, they'll still have to protect a bit, but they won't have faulty mechanics because they'll have been practicing it in the pool. One of the most often asked questions I have is, who does your pool maintenance? Who does your chemicals? And in my clinic, I have a fantastic staff, and we monitor that ourselves. And actually, I check my own pool chemistry very often. It doesn't matter who does it. I do it because I'm a little anal that way, and I want to make sure that when I put a patient in my pool, I know exactly the environment I'm putting them in. I put post-op wounds in, and I want to know that I have a high enough antibacterial, whether it's chlorine, whether it's bromine, whatever you use. I want to make sure that that's at the level I need it to be, so that I know there's no microorganisms growing in my pool. There's no risk of infection. My wounds aren't going to get wet. They're not going to get wet at all. But there's a chance that that pool water is going to come in contact with that patient's incision at some time through dressing, through changing, and I want to make sure my chemistry is right. So we check it ourselves, but no matter who checks it, you need to make sure your chemistry is good. That chemistry, pool temperature, pool chemistry is vital to your practice, so just implementing some program and plan to make sure that that happens is vital, especially if you're getting post-op wounds in, but also because you don't want patients coming out of your pool getting rashes or having skin issues. One of the other big questions that outside clinics often ask me, whether they have a pool or whether they're thinking about getting one, is, how does aquatic therapy add revenue to my clinic? How does it generate money for me? How is it profitable? There are a few really key ways that it's profitable. One of the first ones is it doesn't hurt. It's very pain-free, so my patients don't cancel. On dry land rehabilitation of a total knee is one of the most painful things I can imagine. Dry land rehabilitation of a shoulder is one of the most painful things I can imagine, and when patients hurt, they'll cancel therapy. I have patients who call to see if they can get in for extra days and who were limited because of reimbursement issues on how much they get in my pool and how often they attend PT. My cancellation rate for the clinic as a whole is less than 5%, and we know that industry-wide cancellation rates are usually close to 20%. My cancellation rate for my immediate post-op patients is less than 1%. Less than 1 out of 100 visits on my post-op patients will get canceled, and it's because they want to come to therapy. It's the one environment that they feel comfortable. And there are days they hurt a lot, and they say, you know what, all I want to do today is to get in the pool. And so maybe today all their range of motion and their strengthening and activities happen in the pool, but they'll be here and they'll benefit from it, and they'll progress, and they'll return to functional mobility much quicker because they're able to consistently do the activities that they need to do to progress. Our pools allow us to see a very high volume of patient, and we're very careful in how we bill. We follow all Medicare guidelines with keeping track of time in, time out, unattended, attended minutes, and we make sure we bill for only the time we spend with that specific patient. But because of, first, how popular the pools are my limiting factor in my clinic. They bottleneck me because I'm open for 12 hours a day. I can put 12 patients through both my pools an hour, so I can only see 120 to 144 patients a day based on my pools. And so high volume in my pools is part of how I practice, and making sure that I utilize those appropriately. That goes back to that very first part of having a plan for utilization. I have multiple patients in my pool at a time. It works fantastic, but that also drives revenue for me because I don't have any downtime. Every minute that I'm in the pool room is accounted for with some patient, and so my productivity for my staff and for myself is exceptional because of the volume that I can put in the pool. Because I'm able to put a very high volume of patient in my pool, my pools are very profitable, but they're also very beneficial to my patients. Dr. Cusick said it best when he said, because I have a high volume of patients in my pool, my patients talk to each other. So the post-op day 3 patient getting in the pool for the first time will speak to the patient who's been here for 4 weeks and learn that really it does get better, and that is almost more powerful than almost the therapy that we provide. So truly the versatility of our pools is what drives our profitability. The ability to put multiple patients in, the ability to work on gait, the ability to float a shoulder on their tummy and get full range of motion drives every bit of our profitability. That's why people come to my clinic. That's why I have to turn people away from my clinic.